Our project is the stress of patients under compression of hologic paddle designs for the 3-dimension tomography system. Our problem statement for the project is to quantitatively and qualitatively measure the physiologic and psychologic stress patients face while under the compression of hologic smart curve paddle on the 3-dimension tomography machine. We will do so by measuring the stress response with the following systems detailed below.
Mammography is a diagnostic tool used for identifying breast cancer, which is the second most common cause of death for women in the United States, with approximately 200,000 cases diagnosed each year. Although the lifetime risk for women in the United States is 1 in 8, many women do not receive their annual mammogram screenings because current procedures are extremely painful and cause a lot of stress on the patient.
Hologic is our sponsor and is the leading developer, manufacturer, and supplier in the global mammography market. They produce diagnostic products, surgical devices, and medical imaging systems. Their mission emphasizes on serving the healthcare needs of women throughout the world.
The project's general timeline was grouped into 4 main phases. First, we researched the project, then prepared for the experiment by submitting protocols and parameters to the IRB. Next, we did preliminary testing, and in phase 4, we analyzed the data and drew preliminary conclusions.
The goal of the project design is to quantify a stress response, which we will be doing by collecting both physiological and psychological data.
We recorded the stress response for 4 standing positions used in a mammogram screening. This preliminary data provides important insights as to the stress caused due to the discomfort of the standing position versus the discomfort caused by the paddle during compression, which will be important for the human subject study.
The physiological stress will be quantified using 5 main parameters. EMG will use the Dussel Stringo. ECG and EDA will use the BioPack. Balance will use the Anti-Force Platform Accusay, and the grip strength will use the Jamar Dynamometer.
This image demonstrates the placement of each of the measurement devices. Each measurement device is denoted by a different color.
Each measurement device is collecting individual data and must be analyzed using different software to fully capture how each measurement relates to the overall stress experienced.
2 participants with differing anthropomorphic profiles were used to collect this preliminary data. Smart hand dynamometer data shows that participant 1 has overall stronger grip strength than participant 2, which may impact the stress response. Data is analyzed as root mean square percentage to max. The participant's maximum activation for a particular muscle is taken as 100% contraction. Subsequent data for that muscle can be described as a certain percentage of that maximum. Overall, participant 1 expressed highest levels of activation in positions 2, 3, and 4, and participant 2 did so in positions 1, 2, and 4.
Tonic EDA is used to measure the baseline slow-changing levels of electrodermal activity, or galvanic skin response. A greater value for this measurement indicates an increased level of skin perspiration and physical stress. This analysis shows that position 4 was the position in which participants 1 and 2 experienced the greatest average value of EDA magnitude and where participant 1 experienced the maximum value of EDA. Phasic EDA is used to measure the rapidly changing peaks and levels of electrodermal activity brought on by external stimuli. A greater value for this measurement indicates an increased level of deviation from the baseline measurement of skin perspiration. Deviations from tonic baseline indicate a sudden increase in discomfort levels. This analysis shows that positions 1 and 2 were the most uncomfortable for participant 2, while position 4 continued to be the most uncomfortable for participant 1 based on the phasic EDA magnitude. ECG magnitude is used to measure the changes in electrical activity of the heart. A greater value for this measurement indicates an increased level of activation in response to stress. This analysis shows that position 4 was the position in which both participants experienced the maximum value of ECG magnitude and discomfort. However, this measurement does not add any additional insight using average ECG magnitude for either participant. Heart rate is used to measure the number of contractions per minute, also known as BPM. A greater value for this measurement indicates an increased level of cardiac activity to manage an increase of stress. This analysis shows that positions 1 and 4 were both positions of increased BPM using both average and maximum values for each participant.
An AMPI AccuSway force platform was used to analyze balance. Radial displacement and velocity were the parameters chosen to analyze how much the participant moved and how frequently they moved. The more stable the participant was, the lower these measurements. The highest average velocity for both participants was observed in positions 3 and 4. Both participants had 2 sets of data from 2 different days, and it is important to note how the balance differs. In the future, questionnaires would be important to find out what the participant did that day. ANSYS finite element analysis was used to simulate breast compression with a flat and curved paddle, while varying the density of the breast to examine how deformation and strain may be affected. Preliminary results show that the maximum deformation is at the top of the breast, but the maximum strain occurs both at the top and the middle of the breast. In conclusion, the highest muscle activity was in positions 2 and 4, and the highest velocity was in positions 3 and 4. The ECG data was inconclusive. In the future, after gaining IRB approval, this study should be performed on a larger population using the hologic 3 dimensions mammography system.